what is an RCFCI? And how are some homeless women and men who are living with the AIDS virus being cared for here in San Diego County? Hello, my name is Mike Goupel, and with us today to discuss that and other important issues affecting our community are Molly Henry, the Executive Director of Fraternity House, and Patrick Anderson, the President of the Board of Directors of Fraternity House. Molly, Patrick, welcome to PACE TV, and thank you for being here.
Thank you for inviting us.
Thanks for having us.
You're welcome. Now, Molly, tell us, what is an RCFCI?
That stands for Residential Care Facility for the Chronically Ill, and it is a licensing designation that is set up by the state of California. There are less than 30 in the state of California and only 2 in San Diego County. We have both of those licensed residential care facilities, Fraternity House and Michelle House.
Very interesting. Now, how did Fraternity House get its name, Patrick?
Well, about 15 years ago, when a gentleman by the name of Ray Byerly started the operation, he was working out of a home in a residential area in Oceanside, and some of the neighbors started getting curious as to why there were 10 or so young people living in this house. And when someone asked him the question, what should we tell people when they ask why all these people are living in one house, the answer was, well, just tell them it's a fraternity house. And the name stuck.
The name stuck to this day.
Right.
Interesting. And when was Michelle House established?
Well, we had a long waiting list for the 8 beds at Fraternity House. There was a great demand, so using some money provided by the County of San Diego with a program called HOPWA, Housing Opportunities for Persons with AIDS, we were able to purchase a house in North Vista in 1996, and in 1997, Michelle House opened.
Wonderful. Now, who was Michelle Liddell, is it?
Liddell. Michelle Liddell was a woman, the first sort of public heterosexual woman with the AIDS virus to kind of go public with her status in San Diego County. She became quite an activist for the AIDS community in San Diego, and she sadly passed away several years ago. And it was decided that in her honor, because Michelle House was designated to house women as well as men, that it would be appropriate to name the house after Michelle. So that's what we did.
And her family is still active?
Michelle's family is still very active in the organization. Both her parents, her husband, and her children are always around. They're very much part of the Fraternity House and Michelle House family.
That's very nice. That's very nice. Now, how many people over the years would you say in both houses have been served as residents?
We, excuse me, we have served over 400, mostly men, but a few women as well.
Now, I presume in the early days they didn't stay very long.
Right.
And I imagine by today's standards they're staying a lot longer.
Right.
Yes.
Once upon a time, the average length of stay was very short, and we function much like a hospice. Now things are a little bit different, and the average length of stay is about 12 months. So.
Interesting. Now, how many residents do each house house or home?
Fraternity House has 8 men, and Michelle House has 12 women and men.
I see. And the gender mix is pretty much what?
Well, overall we've been serving about 15% women, which is a little higher than average in terms of the number of women out there with AIDS. We have an interesting mix of racial and ethnic backgrounds, and we've had people as young as mid-20s and people up to mid-70s. So,
Full spectrum.
yes, yes.
Now tell us a little bit about the staffing. How are the houses staffed as far as the needs of the residents?
Because of the needs of the residents and also because of the licensing requirements, there is a trained medical person on staff at each house 24 hours a day, 7 days a week. We joke sometimes that the doors at both houses don't have locks on them because they're always open. We do have mostly what are called CNAs, or Certified Nursing Assistants. That is the general training level of our staff. There are other people with other types of medical backgrounds as well. But 24 hours a day, 7 days a week, 365 days a year, there is someone in the house to take care of those residents and to see that they're getting their medications, getting their food, seeing that all of their needs are met.
I see. Now tell us, Patrick, about the board of directors. What is it comprised as far as different types of people, and how does the board kind of interact with the house itself?
Well, the reason that I'm on the board is because of the type of board that it is. I started as a volunteer at Michelle House working in the garden, and as I became more involved, the executive director at the time convinced me that the board of directors would be a good place for me to participate on a higher level. And because it is a very, very hands-on board, it's not a large board, we only have 11 members currently, it was very appealing to me because they're very actively involved in the running of the houses. It's very hands-on. We have an accountant, we have a doctor, we have a lawyer, we have various other types of professional persons on the board. We have people with HIV themselves. We have people who are affected by HIV through family members. So it's a wonderful mix, and very much, as I said, a part of the family of Michelle House and Fraternity House.
And of course, you two work very closely together in your day-to-day operations, I'm sure.
Well, Patrick is the chair of the board of directors, and Patrick is my boss.
Mm-hmm.
That's how nonprofits work. Is the board is who runs the organization, and we are tax exempt nonprofit.
I see. Well, this might be a good time to see an interview with Michael. Michael is a resident of Fraternity House, and Michael asked us that we tape him from the back and side, videotape him rather than face forward. So of course we obliged. So we'd like to see what Michael has to say. Mike, as a resident of Fraternity House, tell us a little bit about yourself when you first came here and kind of what your thoughts were when you first came to Fraternity House.
When I first came to Fraternity House, I was at the point that I wanted to die because I was really sick and I wasn't taking any medications. And at that point, I had given up. And when I was brought here, I felt that my family had just dumped me here to get rid of a problem, which wasn't the truth, you know, because they couldn't take care of me, and being here, I found myself recovered to the point that I don't think about it anymore.
Now, I'm interested in what your first impressions were when you walked in the door.
It felt, when I first walked into the door, it felt like a house, like a home. It had that home atmosphere. It helped that people here really cared. You know, but when you're sick and don't want to be here, you don't feel that. Gradually, I started feeling that.
Mm-hmm, mm-hmm. Now, what kind of physical condition were you in then?
I had double vision. I had pneumonia. I couldn't walk. I was falling all over the place. Then I was suffering, at the process, I was suffering strokes. And I suffered a series of 5 mild strokes. I was diagnosed in 91.
In 91. Soon after that, did you come to Fraternity House?
I came here in 99.
99. So you were 8 years.
Mm-hmm. I went full-blown AIDS in 95.
What was your outlook when you came here? I mean, I presume it was a little desperate.
I came here with the outlook that I was going to die, and I was to die. I didn't want to be here. But then gradually, I started improving and overcame the strokes and everything. Mm-hmm. And now I feel I don't picture myself here.
What's your expectations? What kind of future do you envision for yourself?
I was recently asked, where do I see myself in 5 years? I see myself trying to educate more people about this epidemic, about this disease, because no one should go through this.
The Second Chance tours. Tell us a little bit about that.
That Second Chance tour is something I started personally, in which I call this part of my life my second chance, because I had been given a second chance, because I could have very easily died, but yet my life was spared, and I feel it was spared to give other people a chance to hear what I've been through.
Positively speaking, now that's another area that you're involved with concerning the community. Mm-hmm. Tell us a little bit about that.
I've been involved with Positively Speaking about almost 2 months. And so it's a program in San Diego that helps people with AIDS or HIV tell the story, put a face to this epidemic. We go to high school and colleges and speak to people.
What kind of response do you get when you're talking to a group of students, for instance?
Basically, it's like I've done 2 talks, and it's phenomenal. I get their attention. They're interested. They ask good questions. None of this, stupid questions such as, are you gay or whatever. No, they're interested because now they see that it is out there. And I've been told recently that people that come here to visit Fraternity House, they think I work here. And they're really surprised when they find out that I'm a resident here.
How does that make you feel?
That makes me feel great.
Yeah.
That makes me feel great.
It should. So basically, all in all, to sum it all up for our viewers, your experience here apparently has been positive.
Yes.
And if someone were thinking about the possibility of coming to a place like Fraternity House or Fraternity House in itself, what would you recommend?
I would recommend that they would come. You're not here, if you come here, it doesn't mean you're here forever.
And there are 7 other residents here
Yes.
presently, so it's for a total of 8.
Yeah.
And from what I've observed, I'm sure you'll agree, it's pretty much like a college dormitory.
Yeah.
People get along to some degree or various degrees.
Yeah.
Any parting words for our viewing audience before we say goodbye?
I would just like to let people know that AIDS is out there, and people have to take care of themselves as well as their partners. And by that, just take care of yourself.
Well, I want to congratulate you. I want to thank you for sharing your thoughts with us, and I want to congratulate you on your recovery, and I wish you many, many happy, long, healthy years.
Thank you.
You're welcome. That was a very interesting conversation with Michael. And Patrick, I was wondering, can you tell us how the medical needs are covered at both houses?
Well, each resident will have a physician working their case, not on site, of course. We don't have physicians on staff, but we make sure that they would get to all of their medical appointments. We also make sure that any medications that they need are administered for them. One of the biggest things with our residents is to get them onto a program of medication. And that's one of the things that we work very closely with the caseworker and with the doctor to do, is get their meds onto a regular schedule. And that frequently will turn the corner for them. We make sure that they get to their appointments, as I said. If they don't need it, we provide other things for them. If they need hospice care, we provide hospice care. If they need rehabilitation care, we provide rehabilitation care for them. We'll get to those obviously in just in a couple of minutes. But any medical needs that they have are met by the house.
That's
in one way or
wonderful.
another.
That's wonderful. And Molly, tell us a little bit about the social services, such as social workers, case managers, and how does someone be qualified to be a resident? Could you explain that to us, please?
Sure. Well, to qualify to be a resident, you have to be HIV positive or have a diagnosis of AIDS and have no place else to go. You're either homeless or in imminent danger of becoming homeless. And most of the people who come to us actually are already in the case management system within the county, and their case manager refers them to us. But there are some people who, we've had the police call us about someone in a motel room or a vagrant or whatever. And when they come to us, if they don't have a case manager, then we will get a case manager for them through the county. And that means that we work hand in hand with the county. We are not the case manager, but the county plays that role. And it's, really kind of checks and balances. We make sure that the case managers are doing their job, and the case managers make sure we're doing our job.
Interesting. Now, how about recreation, fun things?
Right. Well, that really became important around 1996 when some of the treatments for AIDS changed and some of our residents began living longer. Rather than needing hospice care, they were sitting around getting bored watching TV. So we started a program we call the RAP program, Rehabilitation Activities Program. And each house has a RAP manager that is in charge of arranging all of those outings and doing things with the residents, but they're also there to be an advocate and work with the residents toward doing what their goals are.
Why don't we spend a few minutes with Donna? Donna is a resident of Michelle House. Tell us a little bit about yourself as far as being a resident here at Michelle House, and a little bit about your personal background.
Okay, I was born in the Midwest, came to California. After 25 years of marriage, it ended, and so I needed to go on with my life, which I found difficult to do. I went into some nursing classes. I have 6 children.
Oh, really?
Yeah, and it was hard for me to get into nurses training on a full-time basis, so I did it on what they call a ladder program. It was great. It really was. It wasn't high school. It was really good.
Right, and at some point in time, things kind of changed for you, didn't they?
They did.
How did that happen?
I fell in love with a man I still adore. He died 10 years ago. And from AIDS, I was his nurse, his caregiver. And because I didn't think anybody could give him the care that I could. So we were tested in October.
Tested for?
The AIDS virus or the HIV virus. And it showed both of us being negative. And so we were, of course, delighted, and just went on with our lives and working and our everyday projects. And he got sick one day, and that was in November of '89. Now, we were tested in October of '87, so showing up positive for him in October of '89, very, very strange.
Yeah. So that
It was hard on the kids.
I'm sure it was hard on your whole family.
Yes.
And were you healthy for a while, and then you got
Yes, I was healthy for a very long time. Actually, Jimmy was too. His T cells were extremely low, and mine were extremely dry or high. So that would mean I was not as deeply infected as he was. He lived 2 years. My children, it was so hard on them. They hated Jimmy. They hated life. And it's really been difficult. But I needed to tell them up front. I had to, because I couldn't deal with 6 children and 6 different stories, and it just didn't make sense to do that. We would go to men's. They were gay men's support groups.
Even though that didn't apply to you.
Exactly. It didn't apply to him even.
Yeah. But that was all you had, the only resources you had available.
Yeah, was Hillcrest.
And then so there came a point in time where you pretty much had to come to Michelle House for care.
Right. And I'm lucky that I got to be in Michelle House.
Now, when was that, Donna?
That was two years ago.
You would say to women who might consider coming here is to be welcome, to be open to
Exactly.
a zero tolerance for, atmosphere as far as drugs and alcohol.
It's real simple. This is our home. This is our home. I would like it to be, and I feel like it is for me, a transition point. A point where you come from I was extremely ill. I got the last rites 4 times.
Wow.
And where you can go from this hospital setting into a Michelle setting, which is what for me is a transitional position. I don't think I'm going to drop dead today. You never know. But I think there needs to be a place like this to get her through the first 6 months of being on her own. And by the grace of God, she will be here.
Tell us how your first 6 months were, briefly.
I do not remember coming here. I do not remember a lot of the things that were told to me probably 25 times, because I've lost some brain cells. And that, it doesn't help my memory at all. So, from that standpoint, it was learning again. It was learning to enunciate the alphabet. You know, I'm going.
That's amazing that you've come this far.
It's amazing that I sit here and talk to you.
Yes.
It's a miracle.
I can only wish you the very best of luck.
Thank you.
Our thoughts and prayers are with you. Wasn't that a wonderful interview with Donna? Molly, while we're at it, would you explain to us the cost, average cost per bed or per person at Fraternity House and Michelle House?
Well, that's one of the things that's really beautiful about what we do and why we do it. We're actually providing care at less than $100 a day per person, which, if you know anything about nursing homes or hospitals or anything like that, that's far, far more reasonable than the alternatives, and that's why there's such a waiting list, because we can provide those services at an economical rate. So.
Now, Molly, the resident themselves, what is their share of cost if he or she are able to pay?
Yeah, we do have some residents who don't have any income. Most of our residents are on Social Security or something along those lines because they're disabled. And they pay 30% towards rent and 50% towards program services and the care that they receive 24 hours. So that's a pretty, if your income is $700 and you're paying 80% altogether, there's a big incentive right there if you're able to move out to go on into independence.
And does that happen?
Yes, actually, it's really neat for the people who have been with Fraternity House for a decade. They're now getting to see people get better and go back out on their own. About a third of our residents go back out on their own.
Now, that's remarkable.
Yeah, it's great.
Yes. Patrick, tell us about some of the volunteer opportunities that are available at Fraternity House and Michelle House.
Well, ours is an organization that can't live without its volunteers, as is the case with many nonprofits, but I think more so in our case. There are many, many opportunities for people in the community to become involved at either of the houses. Many of them are through the rehabilitation activities program that Molly referred to. There are any opportunities to do anything from drive people to their appointments, to take them shopping, to come to the house and cook on weekends or for particular meals for the residents, accompanying them on many of the activities that the rehab program offers, which can be anything from a movie to shopping to Disneyland, or even an overnight to Las Vegas, which was one of our biggest rehabilitation activities.
That's wonderful.
So, or come to the house and pull weeds in the garden if that's what you want to do. Anything is welcome and appreciated. And all you need to do is contact either of the houses if there are people out there that are interested, and we'll make sure that we find an opportunity for them to get involved.
I know that transportation sometimes is a problem, and I realize that you've just recently, somewhat recently, have acquired your own vehicle to transport some of your residents.
Yes, we do have a van now and a van driver that's on staff part-time, so that a lot of the medical appointments are met by the van driver. But it can't obviously carry all of our residents. When we go to a major outing, we still need other drivers to participate. So it doesn't fill all of our needs, but quite a number of them.
So there are plenty of volunteer opportunities open and available.
Always, always.
Now, Molly, what kind of budget is required for this operation? You're running two big houses with all sorts of things going on. What kind of money is needed to support all of this? Where does it come from? That's the other question.
That's what I worry about every night. A big chunk of it does come from, I mentioned earlier, HOPWA, Housing Opportunities for Persons with AIDS. That is about a third of our funding, but there is always a worry about where the rest of the funding is going to come from. Residents pay fees. Individuals provide funding, and we're always doing fundraisers. We're having Michelle's Walk is coming up that we do.
Tell us a little bit about that.
Yeah, that's along the ocean. It's less than 5 miles along the ocean, but it's a beautiful walk in Carlsbad, and that's one of our biggest fundraisers every year.
When is that?
That's at the beginning of June 2nd this year.
So we have something to look forward to,
Yes.
folks in North County.
Yes. And we always have something going on. Fraternity Feasts is another one of our big fundraisers that's really a neat kind of fundraiser.
Now, I'd like you to talk about that because I had the pleasure of being involved in a fraternity feast at Patrick's house, as a matter of fact, and I had the pleasure of a wonderful gourmet meal in a beautiful home in beautiful settings, and it's a great fundraiser. and you really get plenty for your money.
Right.
I'll have to say that. So why don't you tell us a little bit about that?
Well, it's an interesting concept. This is only the second year that we've done the fraternity feasts. It's a program that I copied from an organization up in Oregon that has been very, very successful with it. And these are a series of private dinners in private homes where the people who come to the dinner pay a fee or a ticket price for the dinner, and the host underwrites the full cost of the evening, so that all of the monies raised go directly to resident care at Michelle House and Fraternity House.
Well, speaking for myself, I couldn't have spent a better evening. The company was charming, the home was absolutely gorgeous, and the food was strictly gourmet. It was wonderful.
We're very excited about the program, and we look forward to its expansion in future years.
And I wish you luck in that area.
Thank you.
We're coming to a close of the program. We have about a minute to go. How would you explain to our viewers what you see for the future, Patrick or Molly, of Fraternity House and Michelle House?
Well, this is an exciting time for us because the County of San Diego has said in their HIV housing strategic plan that they would like another RCFCI residential care facility down closer to San Diego's proper, the city of San Diego. And we're the logical people to do that since we are we're already providing the only two in the county. So we're looking at expanding to a third home.
That's interesting. Of course, the logistics between Vista and Elfin Forest and Escondido and wherever else you're going to have a house is going to be quite a challenge, I would think.
Yes.
And also, I would think that you'd want people to be aware of the fact that your needs as an organization are going to be quite a bit more required than even now to be able to provide that service to the community.
Right.
Thank you both for taking time from your busy day to speak to our viewers and informing us of the service that you provide to our community, and also for letting us know how we can be part of the fine work that you do.
Thank you, Mike. It's been very, very good.
It's been my pleasure for both of you to be here with us. I know what it is to take time out